Hey guys, Ralph Havens here, physical therapist at Beyond Limits Physical Therapy in Bellingham in Fairhaven, Washington. And this is a video to help young runners get over injuries, get healthy, and to run fast. One common thing I find, and you can try this, is to work on a part of the body right here. It's the right side of your pelvis. There's some structures here. Of course, your colon is here, your pelvic bone is here. It's a very common area that can be a root cause. And the technique is to fix up this little area. And what you can do is the belly button is right here, and the bump on your hip, the iliac crest here, is right here. And between the two, you can go from the belly button to that little spot and just touch it. It'll kind of fall into a little hole. And right there, you can put your hands on it, your fingers over it, and twist the skin. And twist it the way that it goes the easiest. In my case right now, it goes easiest this way. And then you're going to take your other hand and you're going to squeeze your own fingers. You're going to squeeze your own fingers like that. So here we go. Here's the bump here. Here's the bump here. I'm going to go towards that bump. I'm going to put my fingers over it, and I'm going to twist the skin the easy way. And I'm going to take my other hand and I'm going to squeeze my own fingers. Now what you do is you stay there for about a minute, maybe 2 minutes, 3 minutes, and just hold it for a bit. Now what's going on is there's a part of the colon called your cecum and your ileocecal valve. It's right where your small intestines go into your large intestines. And for some reason, it's the home base for toxins. So if you're dealing with toxins of all sorts and other stuff, it's even related to some non-physical things, you know, the anxieties and fears of the world. But just fixing it up with this technique, it's called disruption of membrane technique. You fix it up. It's a soft tissue technique from physical therapy, from integrative manual therapy of Sharon Giammatteo, physical therapist, PhD. And you hold this for a minute or 2 minutes. Now, when you're done, you can retest your range of motion, how your hip moves, how your back moves, how you run. You can run before and afterwards. If you're dealing with pain, especially right side hip pain, right side knee pain, pelvic pain, low back pain, even sometimes left side hip and knee pain. Try this technique out. Many times it's one of the root causes of pain that's not going away. So if you've been trying to do a lot of stretches, a lot of strengthening, if you're just dealing with something that's kept you out of running for a few months, this could be a big answer. Now, and we've seen it for runners. I've recently had middle school and high school runners with this exact problem. They were out for many months, lost a whole season, and we did this one technique and they got back to running within a week. The other thing that we did, that's number one. Number two is to go 100% gluten-free. And this part of the colon is affected by gluten. Now if you try it, go 100% gluten-free. There'll be links below of the importance of it and how to do it. If you do it, you can see a big change in your pain. It can go away literally within a day, 2 days, 3 days, a week. So if you've been dealing with hip pain, back pain, knee pain, if you've been out of running for a while and nobody's figured it out, even with good stretches, even with good exercises, even with great coaching and all sorts of stuff, if it's not going away, try this one thing. Just try it and see what happens. Test it right before and right afterwards. The second thing to do is to go 100% gluten-free. You can just test it. You know, I know it's not the most easy thing for a lot of people. I'm gluten-free. My family's gluten-free. My runner boys are gluten-free. Give it a try. So 100% gluten-free and do this thing. Now the third thing to do, I was going to give you 3 things. The third thing to do is to not overcook the training. Don't fly too close to the sun, as they say. And what that means is, you know, if you're a middle schooler, a high schooler, a runner, and if you can keep progressing over the years, you can keep improving. I mean, heck, just waking up, you get faster because you get a little older. If you can do that. If, however, you're training too hard, too many hard days in a row, some easy days that aren't quite so as easy as they should be, multiple races back to back to back. If you're training too hard and you overcook it, you could get injured. And now you're out for a week or 2 weeks, or for the cases I recently saw, for a whole season. And now you got to try to build back up. But if you overcook it again and you're out again, then over the years, you're just down here. You're just down here. But if over the years you stay healthy and you keep progressing and you don't overcook it, you can have some great results. So the key is consistency. The key is training smart. The book, Jack Daniels' book, Running Formula, talks about how can you do the least amount to get the biggest result. And the reason is, if you go over the edge and then you get injured, you're not progressing. So 3 things to do, just to review. We got this technique between your belly button and that little bump right there. You put your hand on it, you twist it the easy way, you squeeze. 1 minute, 2 minutes, 3 minutes, test it out. You go 100% gluten-free, and then you don't overcook it. Make sure you get enough easy days in there. There's real specific ways to do that in that book, Running Formula by Jack Daniels. Give it a try. My name is Ralph Havens. I'm a physical therapist. I've been a runner since I was 12. I'm 65 now. I used to be somewhat fast, 2:28 marathoner back in the day, and I learned the hard way about overcooking things. And so give this a try. Reach out to me. I'm in Fairhaven, Washington, 360-599-2217, and ralphhavens.com, right at the corner of the South Bay Trail. All right, bye now.